This is Perspectivas Latinas, a community service of CAN TV. I'm your host, Juan Carlos Hernandez. Since 2006, the Metropolitan Breast Cancer Task Force has been working to create justice for women of color. Here to talk about their history and efforts, we have Katherine Tossas-Milligan. Welcome.
Thank you.
Well, let's first start talking about you and how you became part of the task force and what you do through it.
Sure. So, we talked a little about my journey. I'm originally from Puerto Rico, and I came here initially to go to grad school at University of Michigan. I worked as a scientist for many years doing bench research. And after a while, I decided to change careers to go into public health, based on, partly what I was seeing in our community and feeling like in my family, there were a lot of women in my family and men who were impacted by many of the diseases that impact our community: diabetes, high blood pressure, high cholesterol. And I ended up getting an opportunity to work at the American Cancer Society doing outreach in our community for colorectal and breast cancer screening. And from there, I got an opportunity to join the task force to do the same thing in breast cancer. So I'm a new member of the task force, and I'm really proud to be with them.
How long have you been there?
I've been there since September.
Just in September?
Yeah.
Of 2013?
2013, yes.
Okay, and tell me about, you've been there a short time, but this task force has been here since 2006.
Correct.
What gave birth to this organization? What were the reasons and the motivation that gave people the idea we need to do this?
Sure. So the task force was born out of some pretty disturbing data that came out of the Sinai Urban Health Institute that was showing that while the mortality trend for white women in Chicago was decreasing over time, so less white women were dying of breast cancer, the mortality for black women remained stable. It never changed.
It never changed.
And so, to the point where, like as of 2010, there was like a 62% gap between the mortality from, black and white women. So for every...
It was that large.
It is that huge.
And it
remains that large.
Wow.
So that, if 100 white women died of breast cancer, 162 black women would die of breast cancer.
Wow. And Latina women, how did they factor in?
So for Latina women is similar. Latina women data is a bit controversial because the data sometimes shows that Latina women die less often, but I do believe that data may be skewed by the fact that a lot of times our women go back to their countries to receive treatment because of the limitations of our healthcare system. And so they're not adequately accounted in the data. So when you adequately stratify the data and you're able to follow Latina women adequately, the disparity looks similar to the black and white disparity among our Latina women as well. In addition, for Latina women, because the screening rate is much lower, it's about 64% of Latina women get screened. By the time that breast cancer is diagnosed, it's often diagnosed at later stages when it's harder to treat.
Wow. And you said that there are other factors that might influence or deficiencies within our healthcare system that push people into maybe their countries of origin. What are some of those deficiencies or things that they might lack here? We have a great and advanced healthcare system in this country.
Well, so that's debatable.
Okay.
In some ways.
I'm just saying that that's the common thought. At least
correct.
When I watch the news or hear about healthcare in the United States, what I always hear is the greatest healthcare system in the world. That's what I hear all the time. So tell me what your thoughts are.
So I am by no means an expert on this subject, but the main thing that comes to mind right away is the fact that, for example, in our Latino community, we have our brothers and sisters who are undocumented and so are unable to access adequate care. And there's always the concern for, costs. And you have to make the decision, particularly in underserved communities or when you have, fixed income or limited income, you have to make decisions around, should I put food on my table and pay my rent, or should I, do the screening? And so to me, as long as we live in a society where our healthcare system, where individuals have to make that kind of decision, then our healthcare system is not working as it should.
So it does become then a question of class in some sense.
Absolutely.
Yes, certainly we have the factors of ethnic background or racial background, like with black women, but then also people having to choose between, like you said, putting food on the table or getting a checkup or something like that.
Absolutely.
And how does the task force go about working against those factors that have such a negative impact on our communities, Black and Latino?
Sure. So the Metropolitan Chicago Breast Cancer Task Force has multiple programs. We have, a multi-pronged approach to eliminating this disparity. On the one part, we deal with issues of quality, and so we seek out, we go out to institutions and we request their data. We have a partnership with the state of Illinois right now where facilities can agree to bring their data to us and tell us about different measures of quality of mammography. And we then report back, and we also provide opportunities for them to get retrained and to learn about just different techniques to do things better. And that is all confidential. We are a patient safety organization, so that's one way in which we work to decrease the disparity. The other way is through our navigation programs. We have a program that's called Beyond October, where we provide free mammography for uninsured and underinsured women in Illinois. And we do that in partnership with multiple institutions, such as like Rush University, University of Chicago, Advocate. Some of the Advocate hospitals are part of, they donate mammograms to our organization. And we are able to then have a navigator. We have bilingual navigators available who can then guide women through the process of getting a free mammogram and getting screened.
And this is for English speakers as well as non-English speakers?
Correct. So we have, right now we have bilingual English, Spanish navigators, but we also have ability to accommodate other languages as well.
What other languages?
So, well, here in Chicago, Polish is one that comes to mind right away. And, we also can have access to language lines where we can do Urdu or Tagalog or, some other languages that are prominent in the Chicago community.
Okay, you say this, the name of the task force is Metropolitan, right? And so what are the geographic areas that you serve? Is it within the city, just Cook County? Who else?
So we really serve women in the Chicagoland area. So we cover basically Cook and what are called Cook and Collier counties, which are 5 counties. Which, if I have to name them, I will fail miserably. But it's Cook and Collier counties. Okay. Truly, but the important thing is that if you have a limitation and have concerns about getting a mammogram, you can call us. And even if you are from out of state, from one of the, boundary states, so Indiana, Iowa, Wisconsin, call us and we will be able to navigate you in different directions. So think of us as a hub, as an advocate. So whether you are from here or not, if you are an uninsured woman, 40 years of age or older, and you need a mammogram, please call us and we'll do whatever it takes to assist you. And
that telephone number and all of that is on your website?
Yes. So, there is a slew of hospitals that we partner with there on our website, and that website is www.chicagobreastcancer.org.
We'll also have it on screen.
Correct, yeah. And so, you can go there for more information. We have these lines available 24/7. You can leave a message and we'll call you back.
Okay, that sounds great. It sounds like you're doing great work and very important work, obviously, for the health of Latinas. However, I'm sure there are challenges in this trying to reach out and trying to get people informed and come in and get screened. What are those challenges, and how are you working against them or to change them? Tell me about that.
Sure. So, that there's always challenges. I'll start with sort of institutional challenges of a nonprofit are always funding, right? We always are constantly applying for grants, and we're always seeking out partnerships, that support our mission and that have the same values that we have around eliminating health disparities. And then there's, with the population that we serve, there are also challenges. There are challenges about where we reach them. We are one of many navigation programs across the city and across the state. There are many navigation programs, and they all have, different flavors. And I think our program is unique in that, different than a program that sits, for example, at a federally qualified health center or a primary healthcare setting where the individual that comes in the door is already primed to seek care, right? And so they're already connected with the healthcare system. We reach a woman, in my opinion, that is more difficult to reach. We reach a woman, we have navigators that literally educate women on bus stops.
Bus stops?
Yes, that we go to your church, we go to your community center, we go to the laundromat if we have to. And I've seen it, and I think that makes us really unique. Therefore, not only do we assist women with seeking mammography, free screening, and to me the mammography is sort of like the hook. We also, if you do not have a primary care physician, we're able to connect you and encourage you to be connected with a primary care facility, so that you can have a medical home, because some of the challenges are that we definitely need mammography, but we also need our blood pressure controlled, our diabetes controlled, our cholesterol. We need to bring our children
in the Black and Latino communities.
Absolutely, yeah. We need to bring our children for immunization. So earlier off camera we were talking about seeking care, and not when you're sick, but seeking care so you remain healthy. And again, we will advocate with and for you so that cost is not a concern.
All right. So as far as the screenings and that this task force helps sponsor, you help sponsor them through all these hospitals. Who else do you partner with? What organizations in government, in the nonprofit world? I don't know. I'm sure you bring in a lot of players into this work of actually seeking to help out Latinas and Black women. Tell me about them.
Sure. So we are open to partnerships with everyone, basically. But some of our main partners and sponsors that I can think of are like Susan G. Komen Foundation is one of our sponsors. We have the Coleman Foundation, who we also have a grant from. The state of Illinois is one of our large partners on the quality side.
Okay.
The initiative that I mentioned earlier is really important because it allows facilities, like I said, to submit their quality data, their mammography quality data, in exchange for them receiving an increased rate of reimbursement for the Medicaid patients that they serve at the Medicare rate, which is about 3 times the rate that they would normally get reimbursed. So it's a really good incentive for facilities to submit their data. And it is, again, all kept confidential. So we have some really key partnerships in the community, but we're always looking for more. We have a great partnership with some academic institutions at University of Illinois in Chicago that we do not only research, but we also do partner around the mammography program. And we have many other partnerships that are sort of in the making as we speak.
Sounds great. Now, you said the state of Illinois is involved with quality. In ensuring that there is quality in the service. What do you mean by quality? Because when I think quality, I think the best, or is that what you mean? Giving somebody the best service that you can? Sure,
absolutely. So, for example, there are a lot of facilities that have a mammography machine, but perhaps their technologists, because they're underfunded or undersourced, have not been able to receive sort of retraining on breast positioning, for a while. Or a lot of times in the mammography field, there is a large culture of what's called each one, teach one, so that somebody learned mammography from somebody else who learned it from somebody else, and now they're teaching it to you, rather than the formal training. And so we can come in and retrain the mammography technologists on the latest and greatest positioning technology so that they can cover more tissue and are able to do proper compression,
Okay, that makes sense. So that women from these communities and from lesser means are getting the quality care that they would receive if they had a lot more money.
Yes, absolutely. So we know that there are facilities in our community that are being underutilized because a lot of people have concerns about their quality. And so, what most programs do is that then they'll refer you to the large institutions, the Northwesterns, the University of Chicago. And we think that that is really good, absolutely. But what we also want to change is to then improve the quality and improve the access to our local hospitals and our local community health, settings, because we know that women will go and our families will go to a community health setting that is closest to them. They're more likely to be able to become established patients there.
Okay. And you said the state of Illinois is involved with that. How else do you work through government, local government, not just state government? How else do you involve them in your efforts?
Sure. So we also have a policy arm, which I haven't mentioned, which deals with, for example, one of the issues that we lobby against was the cuts for the Illinois Breast and Cervical Cancer Program. And this is actually a federal program that provides uninsured women with free mammograms, regardless, again, of your ability to pay. You can make $1 million, and if you're uninsured, you're eligible to receive a free mammogram through this program. However, this program, since its inception, has been severely underfunded, and every year it is threatened with decreases in funding. So we lobby in Springfield year after year to decrease the budget cuts towards this type of funding.
So you have that arm, but what about working with aldermen here in the city or with mayors in towns and other suburbs? Do you do that as well?
Absolutely. So if there is an issue, whether there's a closure at a local facility, or we have concerns at a facility that we know has issues of quality, is unyielding, may not be, maybe reticent to participate. We definitely try to work with local aldermen and with the community to sort of, create partnerships, because this is not about threatening or being us against them. It's really about how do we partner so that we can collectively increase quality for our people.
I'm curious also. I know there are a lot of challenges in this, and there are many stories of women who have not received the care that they need. But when have you known that the work that you're doing? I know you've been there a short time, or what have you been told about a difference that this task force has made in one community or one woman's life?
Absolutely. Well, I will tell you, though, that last year, this is our second year for our Beyond October program, and this year we will probably provide nearly 2,000 free mammograms. Last year we received about 900 free mammograms, and of those women that we navigated and that received mammograms, we were able to find 5 women who were diagnosed with cancer at earlier stages.
Wow.
So, though I have not been here long, I can tell you that is an incredible difference. And all of those 5 women we were able to place to receive proper cancer care for free of charge to the women. And, just to contrast that, I come from the American Cancer Society, that they do incredible work. I led their statewide breast cancer screening programs, and through that program we educated, I would say, nearly 3,000 women, and we found 1 cancer.
Wow.
So it's just a testament to the fact that the women that the task force serve are women that come from very, very high needs, highly underfunded, undersourced, women who are much less likely to seek care.
Yeah, definitely. Now, communities and families can get involved and seek ways to reduce the number of deaths from breast cancer. How can a family, let's say the son or the husband of a woman, and I know there's been some breast cancer in my family, what can I do? Or what can my sisters do? What can we all do to diminish the number of deaths?
Absolutely. So, I think that one of the most important things to do is to have the conversation, to, as men and women, for both, to know your family history, because one of the big misconceptions is that breast cancer is a woman's disease. It really can occur in men and women alike. So if you have primary history of breast cancer, and primary history means, mother, a sister, a daughter that has had breast cancer early in particular, you should know that, and proactively go to your physician and ask if you may be eligible to receive earlier mammograms.
And how does health and diet affect in influencing those factors? Yeah, certainly it's hereditary for many people, and we carry that gene, but there are also other factors in our communities that contribute to the development of the disease, right?
Absolutely. So in fact, genetics is a very, very small portion of breast cancer. It is an important portion, but it's a very small portion. Lifestyle factors are, I would say, venture to say 80 to 85% of breast cancers are really not genetic. So lifestyle plays a big part. And, some of the things that decrease our risk for breast cancer are the same things that will decrease our risk for many other diseases, and we've heard them all. Whether it's like diet, exercise, in particular are big deals. If you are currently a smoker, seek out cessation programs to stop smoking. Smoking is a huge factor for breast cancer. There are also many environmental factors that if you're in a community where you know that there's some environmental risks, also get involved.
Okay. And so it's the same thing for like other diseases like high blood pressure or diabetes.
Yes.
And they sometimes go in kind of, I can't say if they work together, but those diseases are somehow connect sometimes, right?
Yeah, I mean, they do. I mean, so the reality is, I wanted to add and say, when we say lifestyle changes around diet and exercise, it doesn't mean that you have to go and, run 3 hours a day and, stop eating your tamales and your tacos. That's not what it's about. It's really about moderation. I am a big believer on small, what I call Kaizen changes. So, increase fruit in your diet, change soda for water, when you can, and just maybe start once a week. You, instead of having soda for the day, have water. Same thing with exercise. I think that we underestimate the magic of walking. If everybody would just go walk 20, 30 minutes a day, if they could, I mean, it can make a tremendous difference.
Wow. And also, we were talking before the show, you brought in a couple points that we were discussing. The annual checkup. Why is that important?
Absolutely. So mammography, for those in the audience who do not know, is a checkup that is annual, that should be done at ages 40 or older every year. And earlier, if you have a family history of breast cancer. And if you don't know, again, ask your family and ask your physician if you may be eligible to receive screenings earlier. I forgot what we're talking about. The screenings.
The annual checkup.
Yeah. So it's important to get annual checkups because first of all, obviously, is the regulation. You want to make sure that you are not someone who may develop an interval cancer, right? The other thing why they're important is because you may have a mammogram this year, right? And then the following year, that prior mammogram is used as a comparison for the following year mammogram. Okay. So it's important not only that you get them every year so that you can see changes, in your breast. Is really relevant that you go, especially also to the same institution, hopefully that did your mammogram in the year before, so that, again, because they have your films, they can see changes earlier than you can detect them yourself or your doctor can detect them.
Okay, so I'm curious, what age do you recommend women start having mammograms? Is it all based on family history, or what would be your recommendation?
So again, cancer is a disease of the aging, and so the recommendation that we believe is that women should have mammograms starting at ages 40 years of age or older, and have it once a year. This is so in breast cancer, there's a lot of controversy around when those screenings should happen. There are some other organizations that recommend the women get screened starting at ages 50 or older and every 2 years, and we do not believe in that. This is particularly dangerous for our Latina and African American community that have a tendency to develop breast cancers that are more aggressive and at younger ages. Therefore, we, as well as the American Cancer Society, believe that women should get mammograms starting at age 40 and do it yearly.
And if your family history if you have a family history of breast cancer, earlier probably?
Correct. And if you have a family history of breast cancer, absolutely, it should be earlier. And usually the way it works is that if you had a mother, a sister, or a daughter who developed breast cancer, say at 45, then you should get started having mammograms 10 years before that, so at 35.
At 35. Okay. What is your vision? We're getting close to the end of the show here. What is your vision going toward the future for the task force? What are you planning to work in other areas of cancer, or that's my main question. Yeah.
So I think that our vision for this breast cancer organization, just as the American Cancer Society, for example, is that we're out of a job one day, right? I think that our large vision is that we eliminate cancer altogether. But until that happens, we will be here. On the short term, our vision is that at some point we are able to expand and assist with other cancers as well. Colorectal cancer is another one that impacts our community a lot. And so, at some point we hope that we are able to receive funding to be able to assist in other areas.
That sounds great. Well, we're out of time, and it really flies by. Thank you so much for coming out today and sharing this information with us.
Thank you for having me.
Perspectivas Latinas is a community service of CAN TV. If your nonprofit would like to work with CAN TV, call 312-738-1400 and ask for nonprofit services. Tune into Perspectivas Latinas for local issues and concerns every Thursday at 8:30 p.m. on CAN TV 21. I'm Juan Carlos Hernandez. Thank you for joining us.